Good morning, everyone. First of all, thank you for waking up so early in the morning to come and listen to us talk about our work. And I'm here representing the rest of my team as well, Dr. Simunovich, Dr. Chanchon, and Dr. Park, who's here somewhere. So today, I'm going to talk about preventing skeletal-related events in veterans who are on bisphosphonates for bone metastasis. Just a little disclosure, I have nothing to disclose, no financial conflicts of interest, unfortunately. So just a brief introduction, and this is something that we all already know, that multiple myeloma and solid tumor metastasis can cause bone diseases that lead to skeletal-related events, such as bone pain, fractures, spinal cord compression, and also make patients vulnerable to other events such as traumatic fractures. Now, these skeletal-related events can be delayed or reduced by addition of bisphosphonates to standard anti-cancer therapy. And furthermore, data also suggests that if you add vitamin D level, if you optimize vitamin D levels when you're giving patients bisphosphonates, it can further improve response to bisphosphonate therapy. Now, just a little bit about bisphosphonates, and again, this may be something that you all already know. They act by decreasing the osteoclastic activity in the bone, and they're more effective if they're given IV as compared to oral route. So they are effective in helping bone health, but then they do have some risks that are involved with giving these bisphosphonates. Now, one of the risks that everybody's probably heard about is osteonecrosis of the jaw. So intravenous bisphosphonate therapy is related to osteonecrosis of the jaw. And to prevent this, it is recommended that all patients who are going to be on bisphosphonates get a dental evaluation or screening before starting bisphosphonate therapy. And along with this, they also recommend that when they are on bisphosphonate therapy, any kind of dental procedure should be avoided or delayed as far as possible. The second thing is that calcium and vitamin D levels should be checked before starting bisphosphonate therapy, and supplementation should be given to these patients who are on treatment with bisphosphonates unless there is some contraindication. So going with this background, we decided to look at our veterans in our center who are being treated with bisphosphonates for bone metastasis or multiple myeloma, and we basically wanted to see how far are certain guidelines being carried out? Are we assessing, are we screening, doing dental evaluations prior to treatment? And also, are we, first of all, assessing for calcium and vitamin D co-prescribing? And we wanted to measure the effectiveness of such calcium and vitamin D co-prescribing and supplementation. So that's basically what I'm going to talk about in the next few slides. So what we did was we did a retrospective chart review of all the patients who had received bisphosphonates from January 2008 to November 2013. We got the help of our pharmacy department who gave us a list of over 180 veterans who were on bisphosphonates during this time period. And of these, we had to weed out the people who were getting bisphosphonates for other reasons, such as osteoporosis. So basically, not oncology patients, did not have any kind of cancers. Those were taken out of the database. And what we were left with were 117 veterans who had either multiple myeloma or had bone metastasis because of solid tumors, and they were on IV bisphosphonate therapy. In these patients, we assessed whether they had received a dental evaluation before getting bisphosphonate therapy, and we also looked for calcium and vitamin D supplementation. Also checked if they had ever been tested for calcium and vitamin D levels. We also recorded outcomes data on the incidence of osteonecrosis of the jaw in this group, as well as skeletal-related events such as bone pain, fractures, spinal cord compression. So when we got our data, we did, of course, descriptive statistics, looked at how many patients fell into each group that we were looking at, also looked at odds ratios for skeletal-related events in patients who did or did not receive vitamin D and calcium supplementation. So some of the results, just the demographics, most of our patients were males, 97%, of course, it's a VA. We did have 3 females. These patients' ages ranged from 58 years to 92 years. Most of these patients were patients with prostate cancer, multiple myeloma, or lung cancer. We did have a few other veterans who had other types of cancers like esophageal cancer, colon cancer, bladder cancer, as well as renal cell cancer. Surprisingly, and something that made us happy was that all of these veterans had undergone dental evaluation before they started bisphosphonate therapy. So yay, we did really good. And none of them got osteonecrosis of the jaw. So on that count, we were doing great. And that's just a distribution of the patients who, with different types of cancers in our population. So, but when we looked at patients reporting skeletal related events, we had over half of these patients on bisphosphonates who reported that they had some kind of a skeletal related event going on. About half of them said they suffered from bone pain. About 13% had had a pathological fracture. 7% had suffered traumatic fractures, and about 8% had some kind of nerve root compression. And that's what you can see on this graph here. Of course, the highest incidence was reported with bone pain. So then we looked at are these veterans, did they have their vitamin D levels and calcium levels checked? Were they being supplemented? Did they need the supplementation? And we saw that only 78% of these veterans had had their vitamin D level checked before they got their therapy. And even of these 78%, only 69% were found to be vitamin D deficient. When we looked at the supplementation rates in our group, we kind of were not doing so well, because calcium was supplemented only in 34% of this group, and vitamin D was supplemented in only 41% of patients in this group. So but then we went ahead and said, okay, let's look at whether this supplementation really does impact skeletal related events. Are we really making a big deal of supplementing these things, or is there really some reason why they should get the supplementation? And what we found was that in our group, vitamin D supplementation significantly reduced the odds of a skeletal related event in this particular group that we were looking at. The odds ratio was 0.37, and it was significant. So basically, if they got vitamin D supplementation, it would protect them from getting a skeletal related event, any skeletal related event. It could actually reduce their risk by 63%, which was huge. We looked at calcium supplementation as well similarly, and calcium supplementation did not really significantly impact the odds of getting a skeletal related event. As you can see here, if the patient got calcium supplementation, there were about 25% of those patients would report a skeletal related event. If they did not get calcium supplementation, about 29% of them would report a skeletal related event, which was not significant. But for vitamin D, if they got vitamin D supplementation, only 17% had a skeletal related event, whereas if they did not get vitamin D supplementation, 35% had a skeletal related event. So this was a pretty big difference, and it was pretty significant. So what we wanted to specify here was that skeletal related events in this population, veterans who've had who have bone metastasis because of cancers, their onset of skeletal related events can be delayed with the use of bisphosphonates. However, we need to be careful about the adverse effects of these bisphosphonates. So we need to screen these patients for, they need to get a dental evaluation or screening for osteonecrosis of the jaw before they're started on therapy. Also, their calcium and vitamin D levels need to be optimized by checking them, supplementing them before they start therapy, and also during their therapy. In our center, for example, we saw that dental screening was, we were doing great at that level. None of our patients got osteonecrosis of the jaw, but when it came to checking for vitamin D levels and calcium levels and supplementing these two, we were not doing so well. And this is really, really important because it's not that difficult to provide calcium and vitamin D supplementation, and just a little bit of supplementation with vitamin D can actually reduce the risk of skeletal-related events by 63%, as in our study. So prevention of skeletal-related events with vitamin D supplementation especially can improve bone health among veterans with multiple myeloma or bone metastasis. And interestingly, when we started this project, we were looking at the bone health guidelines that had come out in 2009 in the JCCN. And even though they talked about calcium and vitamin D supplementation in cancer patients, and they had recommended vitamin D and calcium supplementation in these patients, they did not really address the need for calcium and vitamin D supplementation in patients who were receiving bisphosphonates. Now, one of the things that happens with bisphosphonates is often they're also given for hypercalcemia of malignancy, and paradoxically, because of how they work, they can cause hypocalcemia once the patient is on bisphosphonates. So it is important to be careful, especially in this group that's receiving bisphosphonates. And over time, as we were collecting data, looking at our results, new bone health guidelines came out, I think, last year in 2013. And interestingly, there is a recommendation in those guidelines as well that says that if patients are on bisphosphonates, they should get calcium and vitamin D supplementation. So somewhere along the line, other people have realized the same thing, how important it is to supplement, especially vitamin D, in patients who are receiving bisphosphonates for bone metastasis. So we need to look at our own data and drive data-driven policies to incorporate these guidelines in our own centers as well. So that's all I really wanted to talk about this morning. Thank you for listening to me.